A pleasure to introduce to you the co-founder of the St John's DermAcademy and our senior fellow from the NIHR, the National Institutes for Health Research, dermatologist Satveer Mahil. So we're very grateful to Satveer is really out to try and improve the treatment of conditions like eczema and psoriasis, giving the right treatment to the right people at the right dose, and also not treating people when they don't need to be treated as well. We also thank Satveer for looking after the world during COVID as well, telling people what to do when they were on biologics and so on. So we have much to be thankful for, and tonight I think mySkin and other things that we're going to hear about. So thank you very much, Satveer.
Thanks very much, and thank you so much to everybody for joining us today. It really means a lot to share our first face-to-face event with you all. So I'm going to talk over the next few minutes about mySkin, which is a new study that we launched last year investigating psoriasis. So it builds nicely on some of the themes that Michael was mentioning just now. So psoriasis has a very variable course for some. There's gradual progression in the disease severity over time. For others, it might be a more fluctuating and variable course, with some days better than others. And in some, from the very beginning, it may start as severe and remain that way over the longer term. But what's important is it is currently very unpredictable. So when somebody first develops psoriasis, it's difficult to know what journey they will take. But as Michael said, there are a few factors, and genetics is a big one that influences that journey. In addition to genetics is lots of environmental factors, including nutrition, smoking, alcohol, and our mental health and our physical health that can interplay into what influences that subsequent journey. So mySkin is all about understanding how psoriasis changes over time and why it changes, and trying to unpick this complex relationship between psoriasis and our physical and mental health. So it's really trying to understand the patient experience and integrating genetics into that so that we can make that patient journey more predictable. And if we can predict how the path is laid out for each individual, then there's the opportunity for us to intervene early, use the right treatment the first time so that we can reduce the longer term burden. Another important theme of mySkin is to try to better track patient experiences and progress over time, and that includes through images as well and photographs. And so that we can try to ultimately better screen and support for both psoriasis and the related health conditions such as mental health, psoriatic arthritis, and obesity. So mySkin is open to everybody who has psoriasis, no matter how severe your psoriasis is or where it affects. It's very easy to take part. You simply go to our website, which is myskin.org, and there we'll ask you to enter information on your skin, your treatments, and how you feel. That's the website, and if you click on the green button at the top, it opens up a simple form that starts with a consent form and ends with the option to upload photographs, and these are self-taken photographs. We will reach out to you every 3 months for the course of 1 year through a simple email reminder and ask you to complete a shorter follow-up survey for the course of a year. And we launched on the 17th of June last year, and so far we have 790 people who've taken part. So what have we found out so far, and what information have we gathered? So the mySkin community is growing, which is great to see. So we have around 80 new participants every month. And so far, the average age of our participants is 51. And the average age at which their psoriasis started was when they were 23 years old. We do have more females at the moment, so 62%. And 1 in 4, so a quarter of our participants, have been diagnosed with a mental health problem. And this really underscores the mental health burden that we know is highly prevalent in skin conditions such as psoriasis. We've embedded within mySkin a screening tool for both anxiety and depression, and 1 in 4 of our participants are screening positive for anxiety and 1 in 5 for depression. Half of our participants have told us that they have a family member who also has psoriasis, which really underscores the genetic component that Michael mentioned in psoriasis. And those who do have a family member, we've learnt that they develop psoriasis at an earlier age compared to those without family members. So this genetic component influences that disease journey. A third of our participants, nearly a third, have psoriatic arthritis. And we asked one simple question to everybody who takes part in mySkin, and that's what triggered your psoriasis for the first time. 1/3 of our participants said that stress triggered their psoriasis for the first time. 13% that said that they had a throat infection, and that was a major factor, and 5% that low mood was important. But what we've learned is it's not just one factor. So the average number of reported triggers to psoriasis onset was 2.5. And people are often telling us there's multiple triggers, and there's a constellation of things that occurs together. So stress, low mood, climate, that's both weather and pollution, has been selected a lot, and lifestyle factors such as weight gain, alcohol, smoking. We also asked participants, what makes your psoriasis worse? And stress, again, comes out very clearly. So 67%, 2/3, say that stress makes their psoriasis worse. Nearly half say that the weather makes their psoriasis worse, and a quarter that low mood is an important factor, and 1 in 5 that alcohol is a factor. And again, it's not just one thing alone. The average reported number of triggers to psoriasis worsening was 3. And often what triggers psoriasis for the first time is the same thing that then makes psoriasis worse later on. So there's consistency there, which is important to know, and as we collect more data, we'll understand this better. So what happens to psoriasis severity over time? So from the data that we've got so far, and this is 9 months data, if you look at the black line in the middle there, it looks like, well, it seems quite stable over time. So the average for all of our mySkin participants sits around there. However, if I can ask you to draw your eye to the thinner lines, so going from the light blue lines at the bottom to the darker blue lines at the top, you can really appreciate the variation for each individual. So this is one individual's journey. So you can see when they first joined us in July, they were mild. Just 3 months later, it was better. And then just 3 months after that, it was moderate. So tracking that individual journey is very important, and we hope that as we get larger scale data and are able to integrate it with genetics through our other study called BSTOP, we'll be able to create a more complete picture. So future plans, we continue to collect data. Please do join us if you haven't already, and keep contributing. We hope that this data set that we're building will help to inform how we can predict disease progression to ultimately help us to know when to treat and with what to treat to improve the health and lives of people with psoriasis. We're developing an app, and we hope that this will be a better, friendlier user interface for everybody, and a nicer, neater way to also capture photographs. We're looking to see how we can use AI to analyse the images that we're collecting so that we can see if we can assess psoriasis severity based on images, again, to feed into better prediction and monitoring for psoriasis. And we're also looking into self-taken blood samples so that you can contribute to research from the comfort of your own home, including enabling genetic testing, but also measuring things like drug levels in your blood. And we'll be implementing that in one of our clinical trials, which will soon start, hopefully next month. So to keep an eye on what we're doing, please go to the website, go to our discoveries and publications page. Thank you to William, who keeps this updated every month. We have a list of our key scientific papers that we're producing, and every paper that we produce, we produce a summary and an infographic to go with it, thanks to the support of the Psoriasis Association. I know Georgia and Taz are here today, so thank you for their support with disseminating our findings. Please listen to our podcasts. So the idea of these podcasts is that it's a way to help feedback some of the research that we're doing. So our first episode was on mySkin, but we're also there are more episodes there on AI and also the Human Cell Atlas. This is our social media, which has been a nice way to grow the research community and also feedback some of our findings. And it's been great to hear from participants about their experiences as well. And we turned 1 year last month, so we were delighted to be able to share personalised summaries to each participant who's taken part in mySkin, where we were able to give them their personalised journey, which summarises the data that they'd submitted so far. Thank you to everyone who supports our research, including the Psoriasis Association, who are here, and this is the team. So we really bring together, as Michael said, there's clinicians, and as Sophia said, clinicians, academics, there's project managers, databases, medical students, and many, many more. So thank you very much.
Thank you very much, Satveer. So myskin.org.